Okay, we are live. I was going to start with Facebook. Hello, everybody. How's it going? I am good. I'm just trying to find the perfect place so I can go live on both. Hello. Hi, Giselle. You're the first person. Hi, how are you? Okay. So let's see. I am also live on Instagram. Hi guys, how are you? Hi Chiedza, nice to see you. Hi Broken Yet Hopeful and Namsa. Hey guys, how's it going? Hey Tati, how are you guys doing? Yellow. Hey Yolandi. Hey Stay. Hi Denisa, how are you guys doing? Hi Cheryl. Hi Zishaba, Mpo. I'm good, thanks guys. How's it going? So interesting to get all you guys here. Hello guys, how's it going? Hello. Hey Tess. Hey Miss Chilies. Hey Shan Shan. How's it going guys? I'm just gonna give it like 2 more minutes and then we can see, then we can start. What do you guys think? Hey Megs. Hey Teresa. Maseko. Hello. How's it going guys? Hey Fadzi. Hey Teresa. Did I greet you already? My goodness. Forgive the nerves. Why, thank you, Yolandi. She says, I ordered you guys to assemble and so you are here. Thank you. I hope I will deliver to your expectations. You know, like today I've got the serious face on because, you know, we're discussing the serious things. But you never know. Maybe I'll be a bit funny. I don't know. Hey, Lerato. How's it going? Nice to have you guys here. Gamu. Anesu, hello, how are you guys? Hi Anesu, hi guys, how's it going? Well, I say 2 more minutes. At 8:03, then we start. Because I kind of feel like we've got a whole lot of things to get through. And I kind of need to get hold of the nerves. Do I look nervous? No? Yes? I am kind of nervous, yeah. But hi Priscilla, how's it going, guys? Hi Mahanyele Valentine, how's it going? Wait, what did Mpo say? I think I missed that. Relax, this is your turf. I know, but you know, it is my turf, but you know how it is. I'm kind of nervous in the beginning. Hi, Diana. Thanks, guys. Hello. How are you? Hi, Tapi. Hello, Tafadzwa. How are you? Okay, guys. 8:03. I think I did say 2 minutes. And we must start. Hey. Hey, Lebachang. Guess what, Lebachang? My name is your name in Shona. Just, you know, Tendai is Lebachang. Hi, Tafadzwa. Oh, thank you. Apparently, I don't look nervous, but you guys don't know. Okay, no, I'm kidding. Fine, let's get into this, guys. So for those guys who just joined Salome Range today, last month on the 12th of August, there was a webinar where the doctors spoke about PCOS, which is polycystic ovary syndrome. I'm just going to try to summarize it because I'm not here to talk about PCOS. I'm here to talk about the natural treatment options we have available on the market here in South Africa. But bear in mind, I don't know all the names. I did try to cram all the names, But you see, this head doesn't have all the names. I'll try to give you as many names as I have. But okay, let's go. I'm going to start. So polycystic ovary syndrome is, as they say, a syndrome. Some call it a disease, some call it a syndrome, but it is, syndrome at the end of the day. And the reason why it's so difficult to diagnose, or a lot of women end up just being told they've got a hormonal imbalance, is because it's got certain criteria that you have to pass. So it's like a tick, 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 and then, oh yeah, you got PCOS. So in 2003, after all in the medical community, with all the arguments and everything that was going on, there was a criteria called the Rotterdam criteria, that where they agreed on PCOS. Where they agreed on the criteria you can use to diagnose PCOS. So number one is menstrual irregularities. So this is where you find yourself with a very long cycle, where you go on your period in January, and the next time you see your period is like in May, or maybe that's a bit dramatic, but maybe January, then March, then August, or whatever. Or you just have abnormal bleeding. I've been trying to claim that name, but I'm just going to go with abnormal bleeding. Or your period is just absent. Like you probably got your period at 13 or so, and then at 16, it just disappears up to today. You've got no period at all. So that's criteria number one. Criteria number two is high testosterone. And in high testosterone, what then happens is it shows up in sort of 2-3 different ways. First, there's adult acne. So you struggle with acne, you try everything, but it just doesn't work. That's the first effect of testosterone. And the second one is the hirsutism part, where you struggle with male pattern balding. I don't know if you've seen some women who are kind of, balding and all of that, or you have extra facial hair, the beards, extra chest hair and all of that. That is the problem of having high testosterone. And the third one is when you have the polycysts on your ovaries. So the Rotterdam criteria says when you've got 2 out of 3 of these, then you've got PCOS. So at times it's not yet, it's much better now where doctors and people who diagnose actually have accepted that Rotterdam criteria. But some old-fashioned doctors still want to see the polycysts on the ovaries, because despite the Rotterdam criteria, it doesn't explain the insulin resistance part. And the insulin resistant part still happens, and it doesn't matter if you're obese or not, you still have the insulin resistance part. So the worst thing is that these side effects affect women all the time, and the end result that keeps most women silent, and why you find Salome Range talking about breaking the silence, is that it ends up leading to infertility. With high testosterone, it's almost difficult to fall pregnant. With irregular periods, it's very difficult to fall pregnant. Now, with the testosterone, with the high testosterone and the high insulin, it just messes up the quality of your ovulation and the quality of the eggs produced during ovulation. So this is the problem with PCOS. Then the last bit I want to get into is PCOS is both a metabolic syndrome and a hormonal syndrome. So the metabolic bits is where I would say we should worry about a lot, because it could lead to type 2 diabetes, which the new name is non-insulin dependent diabetes. But I think we all know type 2 diabetes. It's quicker to say. So 1 is the type 2 diabetes. Number 2, you could have high lipids, which is your high cholesterol, which then leads to heart disease, and that's bad. Then there's the hypertension, which is high blood pressure. That's also not good, because you develop these diseases in the long run. The other thing is endometrial cancer, and this endometrial cancer comes because your uterus lining keeps building and building and building, but because you've got that if you've got those irregular periods, you never get to shed that uterine lining when you go on your period. So this is why PCOS is a big deal, because I've heard a lot of women say, I actually don't want to fall pregnant. I don't feel like I should be on PCOS treatment because I don't want to fall pregnant right now, because they only worry about the infertility aspect. But you have to take care of yourself. You have to be on treatment. You have to manage the disease because of the metabolic effects that happen in the long run. So this is PCOS in a nutshell, and this is what in a nutshell was discussed during the webinar. If you still have more questions on PCOS, don't forget to inbox so that you can get the answers, because I know for some people you just joined us today, but the purposes of this live is that I want to talk about the natural treatment options we have available here in South Africa. It's easier to say South Africa because around the world there's so many different things that are available. So just before I go on, somebody just asked here, does the metabolic syndrome cause weight gain? Yes, it does. It causes weight gain, normally also because of that insulin resistance. So there's two things. You get insulin resistance, and then to compensate that insulin resistance, you get high insulin. So how this high insulin comes about is your cells are resistant to insulin. So then you eat, or you have this primal carb cravings. I don't know if you guys have gone through that if you've got PCOS. So you've got this primal carb cravings. Then probably you indulge in a cake, you have something, you eat just so much, and you keep not getting full. So what that high glucose does in the blood stimulates more production of insulin. And then when you have more production of insulin in your blood, then that's like a high insulin. So you end up with insulin resistance, and at that time, you've got the extremely high insulin. So all of this becomes the problem. And this is why I'm here, so that we can talk about the natural treatment options. So during the live, a poll was had. You said poll was had. Guys, forgive. At times, English just escapes. So I hope you do understand. So during the webinar, they had a poll, and the attendees voted that they wanted to know more about the natural treatment options that are available, or would like, yeah, that's it. I think that's it in a nutshell. But yes, guys. So today, Zihlobo says, you are describing me right now. Got all the symptoms and the cravings never end. Honey, you're preaching to the choir. I know exactly what you're talking about. I'm actually just going to show you guys something. Someone was asking me why I never tie my hair or whatever. But anyway, I also have PCOS. So despite being a pharmacist and being able to know the treatment options, but I also do suffer from it. So I'm just going to show you guys something I don't show everybody. But the acne actually does affect you and can go as far as that. As you can see, I mean, I forgot to put the foundation and all of that there, but you know, the face, I just won't expose it. So let's keep me covered up. But that was just to show you, you're not alone. I suffer from it too, but I've done so much research, and I'm here to help you, not because I'm just a medical professional, but because I understand you too. So, okay, somebody said I can relate to the carb craving and no one understands. You are not alone, honey. I understand you 150%. Yes. Hi, Tina. Okay, guys. So, in terms, yes, definitely. I love that you're talking about it. As you remember, if you saw the stories earlier, ladies, I was talking about this. I will finish off the live and I'll tell you it's not a giveaway, but I'll find a better word. Like I said, the nerves, the English is escaping me. But if you could just go through the stories, I think I had better English there. I will tell you about the products that we have in here, and how we're going to give it away to someone who's got PCOS for you to also get help. Okay, I think the English is getting better. I don't know, guys. Fine. So let's do this. There's so many treatment options available. It's just we don't know where they are, and we probably don't know their names. And I don't know. I don't know why we probably don't know them. But for the purposes of today, I will not, unless a question is asked, I will not necessarily get into the discussion of the nutritional supplements, because they are nutritional supplements. But I am going to talk about, because I mean, there is a lot of products on it. I am going to talk about inositol. I don't know, guys, just by show of saying me, Who knows about inositol? Oh yes, Shan, I understand what you're talking about. When you talk about the cream, I've tried everything. I've just come to accept that I live with all of this. It's just, I cover it here and there. But I am here. I mean, we live. Nobody has inositol. But yes, Hope says the fatigue never ends. Oh, and the mood swings. That is so right. So PCOS also affects how our brains work. So you find a lot of women with PCOS are predisposed to depression and anxiety. And these are the things that are so serious, and we have to really be able to be in a space to help women around us, because at times it's not your fault. You just can't pick yourself up because of the hormones and all of that. Yes, I like it. She says, I know folic helped me with my period. That's very good. I do, but it didn't regulate my period. Why? Okay, I love that question. I will get to it. Bessie says, not me. Sounds very scientific, big words. Please tell me which ones are the big words, because at times I forget. I forget about the big words, and I'm not very sure if I would have broken it down correctly. So before the live, I was practicing. Just by show of response, if I say receptor, is that too big a word, or receptor is fine? We had an argument where my best friend and clinical pharmacist who was helping me prepare said, if I say the word receptor, it's too scientific. So please help. Shanshan says, I'm scared of contraceptive pills because of the side effects. That's also quite interesting. Yes, at least we won't waste a lot of money on hair products. That's so true. That is so true. Okay, guys. So the reason I want to talk about, I know what that you mentioned. Okay, I'm getting to it. Okay, so it's called inositol. That's I-N-O-S-I-T-O-L. Guys, I'm not very good. I need to write it down, then I'll tell you. Okay, I-N-O-S. Wait a minute. There. Okay, I have it now. So it's I-N-O-S-I-T-O-L. I hope someone else is like me. I have my brain is always all over the place. They call it brain fog. But you know what? That's fine. So inositol is one of the natural products that are used in the treatment and or management of PCOS. In some countries, it is now an official treatment, but like here in South Africa, it is not an official treatment. It can be used in conjunction with other treatments that your doctor will give you. So inositol, the one I just spelled out, I-N-O-S-I-T-O-L, is part of the B vitamins, right? Did you know that vitamin B complex is very important for us women? So it's part of the B vitamins. It's actually vitamin B8. So what happens is inositol has got the structure of inositol allows it to have, I will say the word, then I'll explain it, allows it to have stereoisomers. So what stereoisomers is compounds that are alike and just change, just a slight difference in the structure to allow it to bind, oh goodness, scientific words, to allow that product to bind better to the gate. Let's use the gate. So receptor is a gate. I think receptor and gate go very well. So guys, please ask your questions as you go. So there are some people taking note of your questions, because then I'm going to move to answering your questions. I'll read out your questions and then I'll start answering them. So what then happens is the structure of inositol allows it to have quite a number, I think about 8 other compounds that will form to be like the inositol. But the moment something small changes, then, we give it an interesting name. So inositol being the main one. So the groups or the two stereoisomers. Remember, stereoisomers is two compounds that look alike the original compound. So it's almost like inositol has a twin and a triplet, and yeah, like, you know, almost like twins. But you know, like, they're twins, they look alike. If they're they're not fraternal twins, they are identical twins. So they look alike. There's just something that's different about them. So let's look at it like that. So now there's inositol, and then there's these two stereoisomers. Then one of them is called myoinositol. The other one is called D-chiroinositol. So, you know, the scientists actually get to name them into those fancy words. I do sound fancy, right? When I'm like D-chiroinositol. Anyway, so you see, these products are then put in combination, or sometimes like the inofolic that was mentioned earlier by, I've just forgotten, Brandy, I think. Brenda? I think it's Brenda. Sorry, Gary, if I forgot your name. But, you know, it's a brain fog. Forgive me. So she mentioned inofolic. So inofolic has myoinositol and folic acid. So you find there's, like I said, I'm going to tell you the names of the different products that are there on the market that I know of. It's not the South African market that I know of. So now, so there's that myoinositol and the D-chiroinositol. So research has shown that when they are combined together and you take them, it improves the ovarian function to the point that it helps to regulate your periods when you've got the irregular periods. It also helps reduce the high testosterone problems, and it helps you when you've got the insulin problems and you gain weight. Like, ladies, can I ask a question? How has it been for you with PCOS that you work out and work out and work out, and you eat right and eat right and eat right, then lose 10 kgs this month, next month you gain 12. You're like, but I've just been doing it. This is the problem of insulin resistance. This is the problem of high testosterone. That's why you find women with PCOS and insulin resistance, or even just with when you don't have insulin resistance, you still struggle to lose the weight because of the effects of the high testosterone. So these products act in such a way that they combat the effects of high testosterone in women and and the insulin resistance. They are taking note of your product, of your question, Mrs. Maj. So on the South African market, for me to remember, I also kind of have to write it down. What just happened? Sorry guys, the Instagram, something just happened, and it just blocked me out of the Instagram. I actually don't know what happened. Sorry about that, guys. It's probably the network. Hi guys, I'm so sorry. I don't know what happened with the Instagram. It just logged me out. But anyway, seeing that we are on Facebook at the moment while I wait for Instagram, I don't know what happened here. Been trying for 3 years and married for 5 years. I'm really sorry. I can understand how difficult that has been for you. I get, hi Mashawa, I'm so sorry. I don't know what happened with, I don't know. Sorry guys. I don't know what happened. Instagram just logged me out. But anyway, I get extremely heavy periods for 7 days, and the heavy bleeding is for about 2 to 3 days in the beginning. It does happen. Is it normal for me to have extremely heavy periods at the start, and having a period for 7 days is normal? Yes, 7 days is still, hello Warona, 7 days is still within the normal. Those 7 days does show that the length of your period is quite long, but it's not something that is bad or hectic. It is quite normal. And with heavy bleeding and PCOS, that also happens due to the low progesterone. It does happen. However, it's not something that anybody can confirm online that that's what's happening to you, because the 7 days could be your normal. So you would need to still go and for the doctors to carry out tests, which include checking for your hormone levels, your progesterone, your estrogen, your LH and FSH, and those ratios, so that they'll be able to tell you exactly why probably your cycle is long and you've got heavy menstrual bleeding. Sorry guys, sorry to everyone on Instagram. I don't know what happened. The live just logged me out, and the next thing I knew, my phone was off. I'm so sorry, but we can continue. Where did I leave off? Okay, so let me just start again with the myo-inositol and D-chiroinositol. So some formulations have myo-inositol on its own, and it's combined with folic acid, because folic acid is also very good for red blood cell formation, and it's very good for fertility. And curious to know more about the side effects of Intumax. Okay, so sorry guys, I just had a brain fog moment. But anyway, so myo-inositol and D-chiroinositol, what then happens is some formulations have that in combination, and some just have it as one only. And like Inofolic, for example, it's got folic acid and the myo-inositol, and the folic acid helps in the red blood cells, increasing red blood cells, and that is very good for you, because having more red blood cells also increases your fertility. And folic acid also helps with neural tube defects that normally happen to children, especially when you're pregnant. That's why all the time you're pregnant, you always go on a folic supplement. Then there's also Intumax. Intumax has the combination of myo-inositol and D-chiroinositol. And there is Sinopol. There's Sinopol, spelled Sinopol. There is Solga cholinesterol. There is Picositol, which is PCOSITOL. And then Intumax I've already mentioned. And then there is Fertipil plus PCOS. So these are the few that I have come across. There are others. It's definitely not just these ones in South Africa. And just because I have mentioned these ones does not mean that these are the only ones. Like I said, these are the ones that I know and that I've come across. But I know there is more products. However, it always depends with... So these products are over the counter. So if you know about them, a lot of people would go. But a lot of people get to know them. Please, can you post the list on Instagram? Yes. We will post the list on Instagram so that you can get to know about all these products. And there's one more product I had left, and that's the Salome Fertility Capsules. It's got the combination of myo-inositol and D-chiroinositol. I love that question. What makes the Salome range different in the treatment of PCOS? I am going to come to that. So this is it. And the reason this inositol, whether it's on its own or in combination, is very good is that it, at the moment, with the clinical research that's been done, there isn't a problem of the side effects. And normally, medicines that are used as insulin sensitizers and that help with regulating your hormones, the side effects that normally come as a problem are the gastric side effects. You've got diarrhea, you've got constipation, nausea, vomiting, and people don't like that. And you find because of those side effects, a lot of people end up not taking their medicines, and that has always been a problem. And then we've got the problem again where people have an issue with the pill. So I'm not here to be discussing the pill. However, one of the side effects of the pill that makes a lot of women not stick to it is that at times it causes weight gain. So when you already have the PCOS symptoms and insulin resistance and you're struggling with weight gain, then you get onto the pill, then the weight just piles on and on and on. So those problems are the issues that people don't end up sticking to their prescription meds. So this is it, guys. I wanted to talk from my side. Now I want something more interactive with you. I want to start getting to your questions because I've been seeing quite a lot of questions. And since I'm on both platforms, Instagram and Facebook, I'm going to be going, I'm going to be trying to, I haven't seen, because your questions are going to be sent to me just now so that I can just have a look at all of them at once, but I can be answering as I go. So, this question I see here is, what makes the Salome range different in the treatment of PCOS? So the Salome range, the way they put it, so okay, let me explain it this way. Like I said, myo-inositol and D-chiro-inositol are put in combination, with the most common or most popular combination being the ratio of 40:1. 40 of the myo-inositol and 1 of the D-chiro-inositol. The reason you find the D-chiro-inositol is always less is because the myo-inositol is always more the myo-inositol concentrates itself in the ovaries, so that it starts working on your ovaries to improve your ovarian function, which includes ovulation, which includes the quality of the eggs produced, which includes matured follicles. So you want this more. That's why you find when the myo-inositol is in a higher ratio, you realize that we're trying to work on that fertility. And then the D-chiro-inositol is good that in smaller doses it concentrates in itself in insulin target tissues. So then it starts working on those tissues to increase the sensitivity of your insulin, and this helps you with the metabolic part. But how your body works is that the myo-inositol is then also converted to D-chiro-inositol. So it's like a synergy. It's a synergy, and the synergy works in such a way that having that ratio where you've got less D-chiro-inositol compared to the myo-inositol, and I mean, at the end of the day, as your body is working, it's going to convert that myo-inositol to the D-chiro-inositol anyway, so that works for you. It's just how the systems work. When it comes to the Salome fertility capsules, they have gone with the ratio of 3.6:1, and that's according to part of the latest research that's there that has shown that in comparing the 40:1 ratio and the 3.6:1, what then happens in the end is that having it in that ratio of 3.6:1 increases the fertility outcomes. So I hope this does explain it. And if I don't break it down in lesser scientific terms, please tell me. Okay, so Tati says the English is too much for me. Just tell me exactly where I lost you. Tell me exactly where I lost you. I'm going to start answering your questions. Yes, so inositol, again, we spell it as INOSITOL. Yes. And then Warona also said it helped me a lot. Someone said receptors. Please explain. So receptors, so what happens with medicine is that there are these receptors, which I'll call gates. So your medicine goes and binds onto those gates, then they open up and release the medicine into a cell. So when I say that, I know myo-inositol is more concentrated in the ovaries, and it has got a higher affinity for the receptors in the ovaries. I mean that myo-inositol has a higher chance of binding to the gate to release its action or the medicine into the cells there in the ovaries. I hope this is better, guys. I am trying everything I can to break it down. Yes. Does PCOS affect pregnancy? Should a woman fall pregnant without having taken treatment? Yes, PCOS does affect pregnancy. It's got a problem of causing spontaneous abortions, which is miscarriages, and premature births and everything. So when you have PCOS, or if you know you've got PCOS and you do fall pregnant, remember, guys, having PCOS does not mean that you are going to be infertile and you're not going to manage to fall pregnant. While some women struggle with falling pregnant, some women don't even struggle with falling pregnant even though they've got PCOS. So having PCOS and falling pregnant, the first thing I always say is dash to your gynae immediately, because with the PCOS, one of the major problems is that you've got low progesterone and you need progesterone to support that pregnancy. So as soon as you fall pregnant and you've got PCOS, rush to that gynae. Okay, so I'm going through your questions so I can answer them. What else do these products help with besides PCOS? They help with insulin resistance, because at times you can just get insulin resistance without PCOS. So having these products, especially if you get the products with just the D-chiro-inositol, they really help with the insulin bit. As I say, D-chiro-inositol goes and targets the insulin, the target tissues, the insulin target tissues. So having D-chiro-inositol on its own can help you combat that problem you have with insulin resistance and get to losing weight. Please tell me if I miss a question. Type it again, I'll get it. Have you spoken about the drugs on the market? Curious to know more about the side effects of Intumax. The side effects of Intumax, because it contains the myo-inositol and the D-chiro-inositol, is that it's the usual. You can get a bit of an upset stomach, but it's nothing hectic, especially in the beginning when your body is adjusting to new medicine. You could get that. You could feel a bit nauseous, and essentially that's it at the moment with the recorded side effects. And to combat that, if you find that happens to you, then you can first try to take it before food, and if you find that you get that nausea, then try to take it after food, as you see how this works for you. Okay. It's been really hectic with the weight loss journey. Yes, weight loss is a major problem when it comes to PCOS, because of the two factors I spoke about. The high testosterone and the high insulin, they really pose to be a problem. And most of the times we are just told, hey, go lose weight. And then you actually follow the rules. You go on a very healthy diet. From the healthy diet, you move on, you start working, you work out every single day, but you lose 10 kgs, then you gain 12. And that's a major problem. But unfortunately, I'm not talking about the weight loss bit now on what changes you can make, but maybe next time we can then get to talk about how you can manage weight loss in PCOS. Let's say I start taking the meds that Salome supply. Will the physical things, e.g. dark neck, hirsutism, lessen? Okay, so the dark neck is part of the insulin resistance, and it depends how long you've had this dark neck for, because at times that dark neck, the pigmentation that has already happened there could be very close to permanent. With pigmentation, it's another story. So in terms of dark neck, it might not help, but in terms of hirsutism, as the testosterone lowers, it will help with with lessening the hirsutism. Yes. All right, I just got some more questions on here. Does the metabolic syndrome cause the weight gain? Yes, I did answer that one. The metabolic syndrome does cause the weight gain. Definitely. I get extreme heavy, I did speak about this, did I? I get extremely heavy periods for 7 days. This heavy bleeding is for about the 2 to 3 days in the beginning. So the good thing is also, you can try some products that can help you to lessen the heavy bleeding, because at times what happens or what causes the heavy bleeding is that what causes the heavy bleeding is that as you with PCOS, you've got low progesterone. So because the progesterone at times is not enough, and at times you wouldn't have ovulated in PCOS, the shedding of the uterus is just uncontrolled, and you bleed and bleed and bleed. That's what causes the heavy bleeding at times. Not all the time, but like I said earlier, the tests need to be done first. Is it normal for me to have we did speak about this. What makes Salome? I spoke about that. Can I take your product if I haven't checked by the doctor that I have PCOS, but I have symptoms? I always say you need to go to the doctor and get checked, because I probably didn't mention this, but despite having the Rotterdam criteria for diagnosis, but there are 11 other conditions that share the same symptoms as PCOS. So rather than just diagnosing yourself, I would say first go to the doctor, let the doctor confirm that, and you can even talk to your doctor that I've heard about inositol, I've heard about myo-inositol and D-chiroinositol combinations. And then you go with that, because to just diagnose yourself is a bit problematic, because a disease called hyperprolactinemia shares the same symptoms as PCOS. A disease called hypothyroidism also shares the same symptoms, and a whole lot of others with even bigger and fancier names. So please first go to your doctor. How do I know which product is best for my body? It will have to depend. You talk to your healthcare provider, you talk to your pharmacist, you talk to your doctor, and they will be able to help you and tell you which products will work for you. You can even inbox the Salome page. They do have a healthcare provider who is helping people. Should you have problems, you want to discuss more about your condition, your products, just go into their inbox. My sister suffers from horrible menstrual pain and cramps. Can she be helped? Yes, she can be helped. Again, I always say start with the doctor, so we find out what is the cause of the pain. Where is it starting from? Because at times we've become so accustomed to treating and dealing with symptoms only. So let's first get the root cause, and then from there we start dealing with treatment. However, if you would like to try, Salome does have the Salome menstrual pain capsules. But as you know, I'm not necessarily getting into that, as I'm focusing today on the myo-inositol and the D-chiroinositol. Taking the Salome range can assist me with having chances to fall pregnant, and for how long should I be taking the pills? You know what? That really depends on your body. It depends on the stage of your insulin resistance. It depends on the severity of PCOS. Some people have taken the product and within weeks or a month have fallen pregnant. Some people, it is still taking time. Also depends on how your body responds to medicine. The way my body responds to medicine might not necessarily be the way your body will respond to the medicine. As you know, we probably would have lived with these diseases for more than 10 years, and a quick fix won't work. And there's a lot of things that come into play. It's the medicines, and it's also lifestyle changes that have to come together for the medicine to work, for you to get better. Can Salome range be bought online, and can we purchase it via medical aid? Well, that is the good news that we get here. Yes, you can buy Salome range online. If anything, on their website, link in the bio, they have a 10% discount that is happening right now. So if you would want to buy the products, you can purchase them there. You can also find them on Take a Lot. No, technology, right? And then you can also find them in Alpha Farm pharmacies and some selected pharmacies. I think it will be easier because it's quite a long list. It will be easier to then maybe post about them in the stories tomorrow so that you get to know which pharmacies you can go to if you are more of a walk-in type person and you'd want to discuss those products with your pharmacist. Please also advise if one can take the pill and still drink alcohol or should stop as soon as they start taking the Salome fertility treatment. So here's the thing. When you've got PCOS, one of the things you must try and reduce or avoid is alcohol. So should you want to get to that healing phase, should you want to help yourself, my advice would be then don't take alcohol while you are taking the Salome treatment. Not that if you take them while you're taking alcohol, anything crazy would happen. But just as you are trying to heal yourself, they are not contraindicated in alcohol. You can take your alcohol. I hope that answers. The heavy menstrual range, does it also help with endometriosis? It helps if the endometriosis causes you to have heavy menstrual bleeds. If you've got a heavy menstrual bleeds because of endometriosis, because of PCOS, because of fibroids, then yes, the range does help you with those kind of problems. Sorry, perhaps you answered this already, but will taking this supplement, oh yes, I think I did answer that. Is inositol the one that's natural and doesn't have side effects? Yes ma'am. So will targeting the insulin resistance and testosterone result in weight loss? Yes, it will. That and the right types of workouts and the right type of diet. So in terms of diet, I would always say if you don't know much about diet, then you need to see your dietitian, because the thing is we don't always know how to bring our diet together, and there's so many diets at our fingertips and so many testimonies of how this diet worked for me and that one, and people with PCOS end up going through a lot of yo-yo dieting, and yo-yo dieting is bad as it worsens your symptoms for someone with PCOS and results in more weight gain. So that ends up being a major problem. So you would rather, if you don't know which diet is right for you, speak to your healthcare provider, or most of all, go to a dietitian so they can make something custom and tailor-made for you to actually help you with that part. Okay, so these questions are just loading. How long? Okay, I did answer that. What is hirsutism? So hirsutism is I don't know if I should call it a condition, but it's the effects of high testosterone in your body. And this is where you see extra facial hair or extra body hair, and you also have that male pattern balding. I don't know if you've seen some women who start balding around this area and have got those patches of balding here. It does happen, and it kills your confidence. It's not nice to actually go through something like that as a woman. Okay, I think I'm in with the questions. Can someone with fibroids take this? Someone with fibroids can take the heavy menstrual bleeds and the menstrual pain caps. However, the studies for myo-inositol and D-chiro-inositol were done specifically targeting PCOS. I know of some women with fibroids or who've struggled with infertility without any diagnosis, or have had a diagnosis of something else, who've used combinations like the Salome fertility caps that have got the myo-inositol and the D-chiro-inositol, and it has helped, and a lot of women did fall pregnant. However, the way it was made with PCOS in mind. Yes, okay, I've seen that one. Oh, there we go. Thank you. Someone is also helping me. Oh, okay. Did I answer it about how long you start seeing? are the Salome products for other illnesses with the same symptoms as PCOS? Not at the moment. Not at the moment, my dear. But just bear in mind, they will be launching some products soon, but they will be telling you soon. Severe cramps during ovulation, before and during periods, is this PCOS? What can help? No, it doesn't always mean PCOS. It could mean anything from, it could mean anything. So what I would say is, ladies, please listen to me about this one. It is very important. Visit your gynae once a year. Please visit your gynae once a year to check if everything is okay, to have a proper assessment done so that you know if you're good. I mean, yay, you move on with life. But if there's something wrong, then you need to just start treating and dealing with it. So severe cramps during ovulations, no, it does not mean PCOS. It could mean a whole lot of different things. I would say first get checked. And if it's not something that's too bad, then you can get something to assist you with the pain. And at the moment, if you want to go with something natural, there is the menstrual pain capsules. Thank you so much for the information. You've answered all the questions. Does eating meat aggravate PCOS? What are your thoughts on V steaming? Oh, wow. You know what? Sorry, I got lost a little bit there on the Facebook, but I knew that question was going to come on the V steaming. So V steaming medically is a no, because what happens with all of this is, for something to be accepted in the medical field, there has to be clinical research. There has to be trials that have to be seen, and this is more than just client testimonials, as client testimonials can be biased, and there isn't medical research or clinical research that approves or goes with V steaming. So I cannot answer in that capacity to say yay V steaming, unfortunately. Does eating meat aggravate PCOS? No, eating meat does not aggravate PCOS. That's a different discussion on the diet, but no, it does not aggravate. Does the pigmentation only happen on the neck with insulin resistance? It also happens, like you find your inner thighs get a bit darker, especially with bigger women. Your inner thighs are a bit darker, but it's just very, very dark. And around the groin area, you get very dark, and your armpits also get to be dark. That's what happens with insulin resistance. Though the main thing is the back of the neck. It's not always the front of the neck, it's the back of the neck. Ever since I was young, I have only seen my periods 3 times a year. Also do have problems with acne. What condition is this? How can I have regular periods? So unfortunately, Tootsie, I will not be able to answer that question online, because there are tests that need to be carried out. It can be caused by anything out of 12 diseases to have acne and to have irregular periods. So tests need to be done to confirm what the diagnosis is. And yes, you can have regular periods once the diagnosis has been made and we know what it is. When it is PCOS, for example, then you would be put on either medical treatment, or should you prefer the natural treatment options, that's the kind of treatment I am addressing at the moment, which is the natural treatment. Drug-to-drug interactions or drug disease interactions with inositol to look for. So it's not very clear at the moment in terms of drug-to-drug interactions, but if you are already on metformin, which is first-line medical pharmaceutical that is used in the treatment of PCOS, I would always say, if you are on metformin already, there isn't like much interaction, but because metformin also works to improve your ovulation and it works as an insulin sensitizer, which myoinositol and D-inositol does, then I would say before you think of starting the Salome fertility caps, if you're already on on metformin, then first discuss it with your doctor to say, doctor, can I add myoinositol and D-inositol to my treatment regimen already? who would be the best specialist to manage PCOS, a gynae or an endocrinologist? My, you're putting me on the spot here. Putting me on the spot. But anyway, here it is. A gynae can diagnose PCOS, but to be honest, an endocrinologist, as it says, endocrinologist, PCOS is an endocrine disorder too. So endocrinologist is like, yes, they can, they can manage it. However, the gynae can manage it too. So it just depends if you're going to go with an endocrinologist or if you're going to go with the gynae. I think being in either specialist hands, you're in good hands. Personally used Salome menstrual pain and was gobsmacked with how quick and effective it works. Wow, thank you. I mean, I think it's really nice to get to be hearing from you. If I'm balding without being diagnosed, what do I do? Can I use Salome products? Well, it's a bit difficult. I would need to ask you a few more questions to see if you can use Salome products. And I don't think we can do it over the live. It would be quite, I would then my mind would then go all over the place. This is really helpful. Thank you. You're welcome. Is there a link between hormonal imbalance caused by PCOS to vagina-related infections? Yes, there is a link. A lot of women with PCOS struggle with, they struggle with BV, which is bacterial vaginosis, and they struggle with thrush. Some struggle with UTIs. So there is quite a link right there. Was about to ask about V-steaming. I hope I answered you guys about V-steaming. Are PCOS and amenorrhea related? 100%. Amenorrhea is one of the signs that are used in the Rotterdam criteria of diagnosis to diagnose PCOS. Amenorrhea is absence of that. Amenorrhea means absence of period. I'm suffering with endometriosis stage 4, and my gynecologist said that I would be able to have kids. Oh, I think I wouldn't be able to have kids because I don't have any eggs left. Question is, will the medication be able to assist me in this regard, please? Nancy, can you please bring that question to the inbox so our healthcare specialist can help you with that one? I was diagnosed with PCOS and I only get my period after 8 months. Will Salome help me getting a regular period? Yes, it will help you with getting a regular period. However, be patient with yourself and don't forget to include lifestyle and dietary changes to it too. Can you take the supplements when you are a type 1 diabetic? I would say please first discuss that part with your doctor, because with type 1 diabetes, you don't want to mess around with that kind of treatment, because that one is an insulin dependent type diabetes, and because you're already on insulin, your blood sugars drop very much. So you wouldn't want to just add an insulin sensitizer. You don't want to add that right there, because that will give that synergistic effect to drop your blood sugar levels very quickly. No. Diabetic comas are not very, very good. So discuss this with your doctor first, because your doctor would have monitored how your body responds to the insulin and how you respond to everything. Great conversation. Thank you so much. You are welcome. Are PCOS and hypothyroidism related? Yes, they are very much related, because what happens now in PCOS is that it also slows down the action of the thyroid. So in PCOS, one of the tests they always do to make sure, because PCOS can lead to hypothyroidism, or hypothyroidism can lead to PCOS. So when you've got PCOS, one of the tests they do, they do a thyroid function test, and they see that just to make sure that if it's just PCOS, it's just PCOS and the thyroid is not affected. But most of the times they get affected together. So they are very, very much related. Let me see if I've left out any questions. What is the benefit of the DCI, which is the D-chiroinositol and myo-inositol combined? For those who probably just joined, myo-inositol gets more concentrated in the ovaries, and DCI, which is the D-chiroinositol, gets more concentrated in the tissues that respond to insulin. So combining them means you're combating the problem of PCOS, which is the ovary problem and the metabolic side. So having them in combination is very, very good for your fertility. Okay, let's see. Is it wanting to be pregnant only, or so the good thing is yes, hormonal balance, hormonal balance, hormonal balance. That's it right there. The good thing about all of this is that myo-inositol, I mean, there will be a product that's coming very soon that only has the D-chiro-inositol for those who don't want to fall pregnant. But because the D-chiro-inositol on its own, though concentrated and dealing with the insulin, but having a regulated insulin has a good effect on also regulating the testosterone, which is a problem in the ovaries. So there is a product that's going to come for those who are not looking to just want to enhance their fertility, but want to deal with the metabolic effects. So ladies and gentlemen, maybe you want to get into it for your wife, for your sister, for your friends and family. I did show this in my stories a bit earlier. Oh yeah, good. I was worried about the lighting. So that is the heavy menstrual bleeding. It's got Capsella Besa Pastoris. I know it's like those big names. And then we've got the Salome fertility capsules, which have got the myo-inositol and the D-chiro-inositol. And then we've got the menstrual pain, which have got the other big name. But so what I said about this is, ladies, ladies and or gentlemen, somebody tell your story. Share your story with us. Break the silence, because you never know, your story will help someone. And whoever shares their story, if you struggle only with heavy menstrual bleeding, this will be yours. If you struggle with everything, then you get everything. But just from sharing your story, so we continue promoting the Break the Silence, you can get the whole box for you so that you can be helped. So I am not sure if there are any questions I missed. Will Salome range help someone with metrorrhagia? Yes. Listen to you. She's got the fancy words. So metrorrhagia is abnormal uterine bleeding, and abnormal uterine bleeding happens in some women with PCOS, about 6% of the women with PCOS, because metrorrhagia, that abnormal uterine bleeding, is part of the irregular bleeding. So this, oh yes, I need to fix that about sharing your story. I would say, you know what, ladies, share your story and share your story and tag Salome Range and have the hashtag Break the Silence. All right, hashtag Break the Silence, hashtag Salome Range. Share your story. You never know who you're going to encourage, and tell us how this disease has been affecting you, and how you don't have to suffer in silence. That's why we are here. That's why I am here, to help you know and understand the product a bit more. That's why we want this going on. Any other questions I could have missed, ladies and gentlemen, I will be answering them, and they're going to appear in the story, Salome Range page tomorrow. In the story, I'll just put up the question. There'll just be the question and the response on there. Yes, hashtag Break the Silence. That's it right there. Let's break the silence. You don't need to suffer alone. And women, if you're struggling with infertility, you don't need to blame yourself, because you didn't bring this upon yourself. The good thing is there is more and more research that is going into this. So we don't need to suffer in silence anymore. I'm here. Ask questions on the Salome page. Ask questions on my personal page. I love helping women. I'm here for you. The good thing is, as I said in the beginning, we are in this together. I'm also struggling with PCOS, but we are here to break the silence. And I love it. You ladies are putting it up there. Hashtag Break the Silence. Put a story in your stories. Say your story. Break that silence. Let's encourage more and more women who are suffering in silence, and yet they can get help, because there are different products in the market that are out here to help us. So don't shy away. That's why we are here. That's why Salome is running this campaign. It's continuing with this campaign of breaking the silence. Remember, ladies and gentlemen, because I know some of the husbands and some of the partners are here in solidarity with their partner. So let's break that silence. Let's keep it going. And you're not alone. And as I will always expose myself bit by bit, I also struggle with PCOS, and for me, the high testosterone gives me that bad acne. I used to be so shy and I didn't want to talk about it, but now I own my truth. I break my silence. I'm here. Not only am I a pharmacist and I understand how this medicine works, but I'm here. I understand exactly what you're going through, and I know the medicines that can help you. Thank you so much, guys. If I missed any questions, like I said, promise, come back into the stories and I'll be sharing them. Don't forget, guys, hashtag break the silence. Thank you so much. You've been a great audience. Hey, what happened to my nerves? I don't know. Well done, ladies. Great convos. Let's break the silence, ladies. Thank you. Salome has really done great things. Thank you. I'm very glad. Thank you. Thank you, ladies. I hope I was able to answer all your questions. Yes, please, if you don't want to post your story in the stories, please DM your story to Salome Range, because this whole box would be here to help you out. And we love feedback. The more you give feedback, the more you are going to help somebody. But hey, guys, I tried it. The nerves. Whew. Yeah, ne? I'll see you guys. Well, I'm just waiting for some of you guys to go. Like, you know, it's just awkward to be just like, bye. And I'm like, out. So, let's see. Bye, ladies and gentlemen. I actually enjoyed this. I thought it was going to be so hard. But thank you so much. I loved it. I loved talking to you and talking to myself. They do say when I talk a lot, so I guess it does help. Thank you. Thank you so much. Hashtag break the silence. Hashtag Salome Range. I can do it. You can do it too. Let's all break the silence. Thank you so much, ladies and gentlemen. Okay, fine. I'm going to go. I'm going to go now. Okay, Facebook is dropping. Instagrammers, come on, guys, go. It's like so weird for me to just like drop on you. I feel like I'm losing you. I don't want to do that. I'm going to save the lives on... I'm going to save the lives on the feed so that you see. I'm just sorry that the first bit, my phone was jealous, but we were here to fight. We were here. So guys, thank you. I'm going to, okay, Lebu's saying I must drop first. So I'm going to go. Okay, guys, fine. This is the final time I am saying bye, because everyone's like, no, you hang up. No, guys. You hang up. It feels like we're already forming a relationship, right? Salome Range and you guys are forming a relationship. Because you know, the first times of your relationship, no one wants to hang up. So that's it. Fine. I'm going to hang up now. Okay, I'll start with Facebook because I was on Facebook first. Bye, guys. Thank you.